Hello, my name is Emily Belarmino, and I'm an assistant professor in the Department of Nutrition and Food Sciences here at UVM, and also faculty in the Food Systems program. Today I'm going to be talking about sustainable healthy diets and pro-environmental behaviors. I'm so grateful to the GUN for the opportunity to present this work today, and really looking forward to sharing. I'm going to present some very preliminary data from two studies that I'm working on. The first of these studies is focused on some data that we have collected from a national survey, and the other study is going to be based on some work that I'm doing with my undergraduate and graduate students around health professionals and their beliefs, behaviors, and nutrition counseling confidence. Let's go ahead and get started. So as Carolyn mentioned, I work in public health nutrition, and I'm a public health scientist. In public health, we frame behaviors and behavior change using the socioecological model, or we take a socioecological perspective. The socioecological model, as presented on this slide, considers our behaviors as influenced by multiple different levels. So we can think about the individual level. Things like demographics may influence our behaviors here. The interpersonal level, our health behaviors can be influenced by our relationships with friends and family, as well as our relationships and our interactions with our health providers. At the organizational or community level, we can think about things like local policies, organizational policies, as well as social norms. And then if we think about the systems perspective, some of the actions that can influence our behavior here include policies, regulations, and incentives. So my work focuses on the factors that influence the development, adoption, and maintenance of health behaviors, particularly behaviors related to diet. Things like what we eat, why we choose those foods, and how we maintain those behaviors over time. So my research really explores the intersection of three main areas: diets, environment, and health. And it takes an equity perspective on understanding the interrelationships between these behaviors. We know that poor quality diets and the degradation of our natural resource base, as well as the environment, are two of the most important challenges of our times. We also know that both of these challenges are very much related to our food systems. As we consider what we can do to improve diet quality, improve or minimize the impact that our behaviors have on the environment, we also want to keep in mind the most vulnerable among us and what we can do to ensure that healthy, low impact diets are also economically accessible and socioculturally acceptable to a broad audience. So I arrived at UVM about 2 years ago now, and have been working to build my research program around two main topics, or two main areas, which I see as integrally interrelated. So the first of those relates to food and nutrition security among vulnerable populations. And the second of these relates to sustainable food systems and dietary patterns. Now, I see these related for a number of reasons, but I think first and foremost, it's because in order to have food security, in order to have nutrition security, we really need to ensure the economic, environmental, and social sustainability of our food system to ensure that we can continue providing adequate nutrition to the global population moving into the future. My research has, for a long time, for about the past 10 years, focused on identifying opportunities to leverage the food system, particularly the fruit and vegetable supply, for improved diets and health. Some of this work has been done internationally. More recently, I've been focused largely on the US population. So as a graduate student, I had the opportunity to spend a year in Australia on a Fulbright scholarship. And during that time, I looked at the Australian fruit and vegetable supply. My PhD research, my doctoral dissertation focused on fruit and vegetable value chains in Fiji. And then during my postdoc, I had the fantastic opportunity to work on a multi-site randomized control trial examining the potential for subsidized community-supported agriculture to improve both the nutrition of low-income households, low-income families, as well as provide a stable livelihood for diversified CSA farmers. So this has been a long-term interest, and one of the main reasons that I've been so excited about and so invested in research on the fruit and vegetable sector for the duration of my career is because we know globally most people are not meeting the recommendations for fruit and vegetable intake. And in the United States, we know most Americans are not meeting the recommendations for fruit, vegetable, and whole grain intake. So the figure that I added to this slide is from the very new Dietary Guidelines for Americans. They came out less than 2 months ago, less than 2 months ago. If you look at this figure, the line that goes right across the middle shows recommended dietary intake. Anything that is below that line indicates suboptimal intake, and anything that is above that line in the purple with the hash marks indicates intake at or above the recommendation, often in excess of the recommendation. So we can see from this that most Americans are consuming too few vegetables across all of the different vegetable subgroups, too few fruits, and less than 5% of our population is meeting the recommendation for whole grains. At the same time, we have some food groups or food subgroups where most people are meeting the recommendation or exceeding the recommendation. Things like refined grains, most of us are eating more than we need. Also meat, poultry, and eggs. Majority of the population is eating at least as much as they need, if not more than what's needed. So one of my interests related to fruits and vegetable consumption pertains to plant-based diets. Now, plant-based diets are not just vegetarian or vegan diets. They're really any type of dietary pattern that emphasizes intake of fruits, vegetables, and whole grains while minimizing or reducing intake of meat and animal source foods, particularly meat from ruminant animals. So it is very possible to have a plant-based diet and still have meat as part of your diet, including eating meat on a regular basis. But what we do know about plant-based diets is that they are associated with cardiovascular benefits. And for this reason, they have been advocated both nationally and internationally, increasingly in recent years. So this diagram or this figure on the left shows the results of several pooled analyses and meta-analyses. And you can see across each one, consuming a vegetarian diet as compared to an omnivorous diet reduces the risk of coronary heart disease mortality and may reduce risk of stroke. But I think it's important to add that not all plant-based diets are health promoting. It is also possible to consume a plant-based diet that is less healthy than a diet that is more typical or animal-based, we'll say. So, for example, if you look at the figure all the way on the right-hand side of the screen, you can see with the red line showing the dose-response relationship between an animal source diet and coronary heart disease incidence. And then if you look at the other lines that are presented, we can see that eating an unhealthy plant-based diet, so one that includes a lot of refined grains, a lot of processed foods, is actually less healthy, we could say, than eating an animal source diet. We really have to be eating a plant-based diet that relies heavily on whole plant-based foods and minimally processed foods. So lots of fruits, vegetables, whole grains, nuts and seeds, etc. In addition to the health benefits, studies consistently concur that plant-based foods have fewer adverse environmental impacts per serving than animal source foods. Now, this is not to say that there aren't exceptions, and I think place plays a very important role in this. Farm management practices are important and context is important. But when we aggregate the data and look across different environmental indicators, we're consistently seeing that meat and some animal source foods, particularly cheese from cheese that's been heavily processed, things like mozzarella or cheddar cheese, have a greater environmental impact across these indicators as compared to plant-based foods. So if we know that plant-based diets are nutritious and healthful and also potentially better for the environment, what is keeping the population from adopting these sorts of dietary patterns? Well, a lot of research has gone into this area and considered some of the barriers. Chief among them are lack of knowledge about some of the health benefits, nutrition and health concerns with reducing meat or eliminating meat from the diet. We hear this often, especially from men concerned about protein. Limited social or familial support for this type of dietary change, and the belief that it's going against social norms. A lot of people are concerned about potential inconveniences or higher costs related to eating a plant-based diet, including things like it takes a greater amount of effort to prepare these foods. And then finally, arguably the very most important is that a lot of people really enjoy and prefer meat products. I think this last point is very well demonstrated by a quote from a study that I led about 5 years ago in rural Montana. So I was looking at cardiometabolic risk among men, and one of the participants in that study said, a steady diet of just beef is not good, but a vegetarian diet is not living life. And I think this very well reflects how many people feel. So we know that eating a plant-based diet can have a major impact on our footprint, our dietary footprint. But it's not the only pro-environmental behavior that is related to what we eat and how we eat, and our food-related patterns. So the other major food-related pro-environmental behavior that we know can have an important impact on our impact is reducing food waste. Then there's a number of other behaviors which may or may not have an important impact and are sometimes largely context specific. These include eating local in-season foods, choosing meat and fish with sustainability labels, choosing foods that have less packaging, and using reusable shopping bags. I was really interested in understanding how COVID-19 may or may not have impacted pro-environmental behaviors related to food, so the behaviors that we just talked about. And so the first study that I'm going to be presenting on today is on this topic. This work was done through the NFACT collaboration. So NFACT stands for the National Food Access and COVID Research Team. I'm part of the executive team for this project. The principal investigator of NFACT is Meredith Niles here at UVM. Beryl Bertman at UVM is another collaborator. Also on the executive team, we have colleagues at Johns Hopkins, Arizona State University, and University of Arizona. Now, NFACT as the name implies, is a national collaboration. We have research collaborators across the country. And the real special sauce of this, I would say, is that we are using a shared survey instrument to collect information on food access, food security, and food-related perceptions during the COVID-19 pandemic among different populations, and trying to understand where there are particular vulnerabilities and where policy action may be most helpfully directed. Now, the work that I'm going to be presented today has been funded by a number of different groups. Here at UVM, we received funding from CALS, the Gunn Institute, the Office of the Vice President of Research, and the new ARS Food Systems Research Center. COVID-19 created all sorts of shocks in our food system that reverberated all the way across food supply chains. We can think also about the very rapid and radical changes that happened in home food environments and home food management with the pandemic. If I think of things in terms of the socioecological model, I can consider these shocks really happening at every level of influence. So if we think at that systems level, we can think about some of the shocks that were experienced as it pertains to prices and supply. On this slide, I present some data from the USDA's Economic Research Service on retail prices of beef, pork, and poultry over the past 2 years. And we can see that in March, April, and May of 2020, those early months of the pandemic, we really saw prices for these products spike and a supply shortage. One of our survey respondents spoke exactly to that point, and some of the anxiety that they felt and the nerves that they felt about not being able to get the products that they consider to be staples, like meat and eggs, because the prices were going up and there was no inventory for these items in the store. Now, if we think about some of the other levels of the socioecological model, we can also think about shocks that happened there that could possibly impact other pro-environmental behaviors. For example, we saw state and local governments that had plastic bag bans in place, suspending enforcement of those bag bans early in the pandemic. We also saw a number of grocery retailers prohibiting use of reusable bags early in the pandemic for fear that they could harbor the virus. If we think at the interpersonal level, there were so many changes in all of our lives as social distancing measures came into place, and many of those changes impacted where we eat, when we eat, and what we eat. And then finally, if we think at the individual level, there's many examples, but I think chief among them are that circumstances for millions and millions of Americans changed in the early months of the pandemic as unemployment skyrocketed. And some of those changes, economic changes, most impacted people that are working in the service industry, including food retail and the food service sector. So the NFACT survey that I'll be talking about today included 6 questions on food-related pro-environmental behaviors pre-pandemic, and then in the first 4 months of the pandemic. This survey was administered to 1,510 US adults recruited using our Qualtrics survey panel in July and August 2020. Our sample was representative of US adults with respect to race. We also oversampled low-income consumers as a way to gather additional information about them. And then prior to analysis, we weighted our sample to reflect US adults with respect to income, race, and ethnicity. So here I show the proportion of the population who was engaging in each of these pro-environmental behaviors in the year before the pandemic and then during the first 4 months of the pandemic. And I think there is some interesting takeaways that we can gather here. First of all, we didn't see a lot of change across these different behaviors. There were significant changes as it pertains to choosing a vegetarian option, local food procurement, choosing foods with sustainability labels, and using reusable shopping bags. But these changes tended to be quite small. I do want to point out that food waste reduction looks a little different here because the way that we asked that question didn't include a measure of pre-pandemic food waste. Rather, we asked participants whether they had reduced food waste during the pandemic, and we had over 52% confirm that they had. So I really wanted to understand what factors predicted engagement in each of these pro-environmental behaviors during those first 4 months of the pandemic. And so in the models that I built, I looked at the 3 demographic factors that we know to be consistently associated with pro-environmental behaviors: female gender, increasing age, and increasing education. I also included children in the household in my model because we know that households with children had really unique disruptions early on in the pandemic, especially as kids were sent home from school and were eating more meals than usual at home. And then I included 2 measures of hardship: job disruption during the pandemic as one measure of financial hardship, and food insecurity as a measure of material hardship. What we could see is when we think about the odds of choosing a vegetarian meal over a meat-based option, women, midlife adults, and those with greater education were at increased odds of doing this. We also saw that these economically vulnerable households, those that had a job disruption or were food insecure, also had greater odds of choosing vegetarian option. When we think about food waste reduction, women and older adults were more likely to engage in this particular behavior. When we think about buying local, we saw greater odds of purchasing local food during the pandemic among older adults, adults with a college education or more, and those who had experienced a job disruption. When it came to choosing meat and fish with sustainability labels, we saw this to be more likely among midlife adults, those with more education, and food insecure households. When we think about packaging waste reduction, we saw this among all of the 3 demographic groups that we would anticipate seeing it among, as well as economically vulnerable households. Of interest, we saw the odds of choosing foods with lower packaging to be lower among households with children. This could possibly be related to more packaging being sent home with school meals that were being delivered or picked up by families. Another possibility is parents really had to shift what they were feeding their kids, and it's possible that there was more packaging in some of these foods. And then finally, when we think about reusable shopping bag use, I added a state plastic bag ban to this model, and we can see that more educated adults, food insecure adults, and also people who lived in a household in a state with a plastic bag ban were more likely to engage in this behavior, which is great. That is what we would expect to see. When I think about factors that predicted stopping food-related pro-environmental behaviors, we're looking at a much smaller sample, but I really wanted to understand why someone might engage in these behaviors before the pandemic and then stop. And so we wanted to understand this. For choosing vegetarian, we saw households with children and economically vulnerable households were more likely to stop choosing a vegetarian meal over a meat-based option. We think about food waste, women and older adults were less likely to increase their food waste, while children, those with a job disruption, and food insecure households were more likely to increase their food waste. Those who stopped buying local were more likely to be food insecure. Those who pre-pandemic chose fish and meat with sustainability labels and then stopped doing this were more likely to be those that were economically vulnerable. When it comes to individuals who pre-pandemic chose foods with less packaging and then stopped doing so, we're more likely to see this among food insecure households. And then finally, when we think about who stopped using reusable shopping bags that was using them before, we were more likely to see this among midlife adults, individuals who experienced a job disruption, and individuals in a state with a plastic bag ban. Interestingly, households with children were less likely to stop using reusable shopping bags. So if we think about some early takeaways from this research and implications for future research practice and importantly policy, I think some of the most important findings are, first of all, food-related pro-environmental behaviors were largely sustained during the pandemic. We did not see dramatic dips in these behaviors, suggesting that many people who were engaging in pro-environmental behaviors continued engaging in those behaviors. We also see that upstream interventions in the food system can have significant impacts on food-related pro-environmental behaviors. So of great interest, states with plastic bag bans, more people in those states are using reusable bags, which is great. That's exactly what we want. We also see that particularly in states that have plastic bag bans, early in the pandemic when those bans were not being enforced, we saw a dip in use. And then finally, I think something that's very important to mention is that economically vulnerable households appeared to be most likely to stop engaging in a range of pro-environmental behaviors. And so we need to be really careful and thoughtful about ensuring that the policy packages that we put forward, the proposals that we put forward aren't regressive and are not going to impact some households more than others. So I'm going to shift gears now and talk about another study that I've been working on in collaboration with a number of my students. And this pertains to health professionals' behaviors and beliefs around plant-based diets and nutrition counseling. So we know that health professionals are often called upon for nutrition advice. We know that nutrition counseling can have a positive impact on patient or client health behaviors, nutrition behaviors. We also know from prior research that many health providers lack confidence in providing nutrition counseling. Interestingly, work in the physical activity space has demonstrated that health providers' personal practices influence their confidence with counseling on those practices. And that more confident providers provide better quality counseling. So we wanted to navigate this space together. And I really got interested in this question in the last few years related to the debate that's been happening nationally about the use of dairy names, particularly things like milk, cheese, and yogurt to describe plant-based products. So things like soy milk, cashew cheese, for example. Now, there has been legislation put forward. The Dairy Pride Act has not been successful in passing, but the Food and Drug Administration has also been working in the space to try to understand perspectives on this issue. And they issued a call for comment a little over 2 years ago. So I wanted to understand what some of these perspectives were. I used a Freedom of Information Act request to download all of the unique comments that were submitted, and of interest, very few of those, only 191 came from health professionals. And we saw that health professionals had very different perspectives, especially as it pertained to the nutrition, quality, and content of these foods. So for example, we had some health professionals, if we think specifically about protein, that said that they believe the most significant nutritional differences is protein, but protein isn't necessarily lacking in the American diet. And then other health professionals who expressed great concern about patients switching from dairy milk to a plant-based milk because of the lack of protein. So we did an online survey with health professionals to gather their knowledge, attitudes, and behaviors about nutrition counseling. This was focused in Vermont. We also did a national Facebook campaign to get more perspectives. And we had 273 health professionals complete the surveys between November and last week. We also had additional surveys completed by students in health professional degree programs, but I won't be presenting those today. What we found is that many health professionals, particularly registered dietitians, described their diets as plant-based. Definitely not all, but a good proportion. Over half of dietitians said, my diet is plant-based. We also found that most health professionals would recommend plant-based milks to patients under certain conditions. In particular, if a patient had an allergy or some type of related concern, but that when we asked health professionals about concerns that they might have about the nutritional content of plant-based milks, dietitians were the only category of health professionals who expressed worry about the protein content. So you can see that represented here. Switching gears a little bit, we asked health professionals the topics that they felt should be considered in nutritional counseling. And I found it absolutely fascinating that right at the bottom of the list is where we see environmental sustainability and agricultural production practices, with only a fraction of health professionals reporting that they consider these to be topics to bear in mind during counseling sessions. And the health professionals that were most likely to feel that these were topics that should be considered were dietitians across both behaviors, and then also for considering environmental sustainability, people that themselves had a plant-based diet. So some quick takeaways from this, we can see that health professionals are more likely to worry about the nutritional adequacy of plant-based milks. We can also see that they are more likely to consider environmental dimensions of food choices and bear these in mind with their nutritional counseling. And so if we think about what might be some implications for practice or policy, it suggests that health professionals, dietitians take more 360-degree perspective on these behaviors and how they're related to not only health, but the environment. And we might have some things to learn about dietetics training that could be useful for training for other health professionals. So I will end there, and I'll just leave with a big question of how can we make healthy foods from sustainable food choices or food systems easier choices, thinking about possible action that we could take at all levels of the socioecological model. So thanks so much.
Wonderful. Thank you so much, Emily, for that great presentation and sharing your research. I want to remind everyone who's on the webinar today to please use the Q&A box to submit any questions that you have. We do have a few to get us started here. All right, so Emily, one of the questions was in regards to the graph that summarized the different environmental impacts of different foods at the beginning. And as I preemptively shared that I think that was from the Eat Lancet Commission report, Willett 2019. Yeah. Great, yeah, that's such a helpful image and summary of environmental impacts. And then we have a few questions here. So Nick Delory is asking, how does dairy factor into your diet? Are there substitutes that are healthier? So this question came a little bit earlier in your presentation, and then it was really interesting to hear some of your research on this topic. But would you like to address that?
Sure. So thinking about what are some healthy alternatives to dairy? Is that the question?
I believe so, yeah. And how does dairy overall, what role does that have in the diet?
Yeah, so dairy is a valuable source of protein as well as a range of micronutrients. We have high levels of things like calcium and vitamin D in dairy products. There is one plant-based product that is considered comparable with dairy if we think about the dietary guidelines, and that's fortified soy milks and fortified soy yogurt. So the dietary guidelines does state if you consume dairy, consume low-fat or fat-free dairy. That's what it's recommends low-fat or fat-free dairy, or consume a fortified soy milk or soy yogurt product. The other plant-based milks are not included in the dairy group of the dietary guidelines, and that is because they are nutritionally different. I didn't have an opportunity to say this, but one of the reasons that I was so interested in this debate about dairy and plant-based milks is because there are very important and significant nutritional differences between these products. I think it can be quite confusing for consumers as well as health professionals. And they have very different environmental impacts, and understanding the differences in those environmental impacts and the trade-offs can be really tough. So, we hear in the news all the time, for example, about almond milk and the high level of water that goes into producing almonds, especially in California. And so some of these, trade-offs are really hard to consider, and I wanted to understand consumer and health professionals' perspectives more.
Great, thank you. I am going to take advantage of my moderator status here and ask a clarifying question, a little more follow-up on the last piece of research that you were discussing around the beliefs and perceptions of health professionals and plant-based diets. And you discussed the perceptions that dietitians in particular have. I'm just curious to hear what other kinds of health professionals were included in this survey. What kinds of backgrounds they have and compared to dietitians.
Yeah, absolutely. So this survey was led by my graduate student, Bridget Clark, and we just closed it about a week ago. So we definitely have more analysis that we can do to tease apart the different perspectives. But the health professional groups that we targeted were those that have direct interactions with patients that could result in question and answers related to nutrition. In particular, we targeted dentists and dental hygienists because nutrition is often a topic that comes up at the dentist's office. We targeted physicians, physician's assistants, and nurse practitioners, as well as RNs and LPNs. And then we additionally targeted dietitians. And with each of these health professional groups, in addition to reaching out and surveying health professionals, we also surveyed students who are enrolled in these health professional degree programs or are juniors or seniors in college and planning to apply to a dietetic internship, for example, or medical school.
Great, thank you so much for clarifying. Have an active Q&A box, which is always exciting to see. There's a question up next from Bailey Kretzler. What influence do you feel the industrial agriculture system has on accessibility and perception of plant-based diets?
Oh, that is such a great question. I definitely think that we can see from the evidence that there has been a surge in the last few years in the market for processed plant-based foods. So this includes plant-based milk products. It also includes more processed plant-based foods, things like cheeses and burgers and lots of foods that are targeted specifically to people who are looking for alternatives to meat and animal source products in their diets. On that thread, we have seen this really interesting growth in meat that is either cultured from animal products or in other ways made to resemble animal products. And I think that there are interesting pros and cons there, because some of those products are much more expensive. They're highly processed, they're much more expensive. They don't necessarily contribute all that much to a healthy dietary pattern, but at the same time, they could provide a gateway to adoption of a more plant-based diet. So I don't know about the research in the area of introducing those products and consumer acceptability, but I do think that would be a really interesting area to explore further.
Thanks, Emily. And for those who are active in the Twitter space and online, there's been some interesting discussion around some comments that Bill Gates has just made about wealthy countries switching to 100% synthetic beef. So if you're interested in following that discussion, I think you could find some interesting chatter in social media these days. So we also have a question here about how allergies impact plant-based diets. How do allergies interact with these diets, and what are some healthy ways to eat more plant-based and still get enough protein, even if you can't eat, for example, nuts?
Oh, that's a great question. I think in a different context, I would bounce that question straight to a dietitian, because I'm not one. But plant-based diets, it is totally possible to get an adequate amount of protein from plant-based sources, and those sources don't have to be nuts and seeds. We know, for example, that legumes and some grains have high levels of protein. I didn't mention it, I don't think, in my slides, but nuts and seeds are another dietary subgroup where most people aren't meeting the recommendation. So that doesn't help many people with allergies, but for those who don't have allergies, consuming a greater amount of nuts and seeds is a great way to gain protein. I do want to say something that I didn't mention, but I think is really important, especially when we're thinking about these questions of industrialization and different types of processed products. Everything I talked about today really only applies to a high-income country context. So we know that in many parts of the world, it wouldn't be advisable to recommend that people limit their consumption of animal sourced foods, because those foods can provide a range of valuable nutrients, and their accessibility is absolutely essential to meet the nutritional needs of a population. So I just want to point that out. Everything I'm talking about really relates to a high income country context, particularly the US context.
Great. Yeah, important clarification there. So we have a question from Brendan Fisher, who is asking if you can speak to the logic behind why folks in lower economic income bands would reduce their engagement with low to no cost pro-environmental behaviors.
Yeah, that's a great question. So we saw that food insecure households and households with a job disruption were more likely to stop choosing a vegetarian option, and also more likely to increase their food waste. My early thoughts on this, these are really preliminary data, but my early thoughts on this is that it might have to do with overall household disruptions and difficulties with the management of choices within a household. So it's possible that people had less time or other resources to make the choices that they wanted to make. So maybe they were choosing vegetarian options pre-pandemic, but then once the pandemic hit, for example, if someone was eating a lot of plant-based processed veggie burgers, for example, we have some anecdotal information that some of those products, the prices went up, or they were less available, as well as animal source foods. And so it could be that people had more difficulties in general with their household food management, but that's definitely something that we need to explore further. Yeah, great question.
Great. On a similar note, Taylor Ricketts is asking your results on what factors associate with people stopping pro-environmental behaviors. Each one of these, food insecurity is significant. And he's asking, this seems to suggest that sustainable food choices are still perceived as a luxury. Do you agree? And is that a fact about more than simple price? And it's a good follow-on question to the one you just answered in your response.
Yeah, I think it depends on what the behavior is. So I suspect that some of the pro-environmental behaviors that we looked at that do often come with a higher cost, consuming local foods or choosing local foods, buying foods, buying meat or fish products that specifically have sustainability labels. I suspect that people cut back on those behaviors because they were more expensive and price sensitivity was a real thing. There's other behaviors, like I mentioned, things related to household management of food, particularly what types of meals you're eating or serving and the amount of food that you're wasting. That I can imagine households that were undergoing greater levels of stress, greater levels of distress during the early months of the pandemic just had a much harder time managing their household food resources. It's definitely something we want to explore further, and we'll be collecting a second round of data for a whole a second national survey, asking the full portfolio of NFACT questions, including these questions about pro-environmental behaviors in the next month. And so it'll be really interesting to see if we've seen shifts either back to some of these pro-environmental behaviors as the food system is seeming a little bit less tumultuous, or whether people who are experiencing hardship have continued giving up on some of those behaviors. I should note though that it really was quite a small number of people, quite a small proportion of these populations that did stop doing the behaviors.
Great. Let's see. Trying to give you a sampling of questions on different topics and different parts of your research here. And this relates to one of your early slides where you showed the interaction between some of the core components of your research, diet and environment and health, surrounded by equity. And so we have a question from Bailey Kretzler. How do you see food access and food apartheid factoring into the adoption of plant-based diets?
Yeah, that's a great question. I think there's certainly been framing that plant-based diets can be elitist, and I don't think that it helps efforts to promote diets that are healthier or more sustainable. But I also, we have very good evidence that access to nutritious plant-based foods is more limited in certain communities, including at-risk communities, those that are low income, those that are rural. And I have a study that's just about to launch, I don't know if I mentioned this, looking specifically at rural populations and some of the factors that challenge the adoption of plant-based diets in rural communities, as well as some of the factors that enable positive deviance to meet the dietary guidelines when it comes to fruits, vegetables, and whole grains. And so hopefully with that work, I'll be able to start teasing that apart a little bit more. But there definitely are access barriers that impact different communities differentially. Yeah.
Great. So we have a question here that is getting to some of your more recent research with health practitioners, health professionals. Rochelle Gould asks, do you have any insight into why in the health practitioner study, environmental concerns were at the bottom of the list? And why were these concerns not seen as valid content for dietary counseling?
Yeah, that's such a great question. And it's something that I am really excited about diving into further. If there's anyone who's interested in collaborating on work to explore that more, I'd be really interested in speaking. I have a hypothesis that it has to do with the education that different health providers are provided during their training. So, for example, we know that dietitians have rigorous several years of training in nutrition, dietetics, counseling, clinical aspects, public health aspects of their jobs. And so they are increasingly well prepared to look at our food choices, look at our dietary decisions from this holistic perspective. Other health professionals receive very, very little training when it comes to nutrition. Often this is an elective course that they can take. There's pretty good evidence in the literature as it relates to the limited training that physicians receive. And so I think that's something that I'm interested in looking into further in the future, is trying to understand what type of exposure do health professionals have to some of these topics in their training. In the study that we did, we did ask a couple questions about inclusion of nutrition and related topics in the curriculum. We didn't ask questions about food systems related training, but I wish we had, and hopefully it'll be something to explore in a future project.
Thanks, Emily. So we're nearing the end of our Q&A time here, so I'm going to hopefully squeeze in at least one more. Thanks again for all these great questions that are being posed. Let's see. What recommendations do you make to those involved in creating policy that helps increase accessibility of regenerative food to marginalized communities while encouraging pro-environmental behavior? And I'll just sort of add or include my own little spin on that too, which is increase accessibility and like awareness of agricultural methods that support pro-environmental behaviors and environmental sustainability to marginalized communities.
Yeah, absolutely. I think that there is an education piece. Certainly, that is something that we know education is important. We also know that it's not sufficient. Where I suspect we would have the greatest impact is if we think about the public policy systems level and think about a combination of incentives and regulations. So there's been a wide range of work in the nutrition sector over the last 10 or 15 years looking at opportunities to incentivize fruit and vegetable consumption. I think some of the work that I did during my postdoc with colleagues at Cornell and Texas A&M and UVM and other institutions is the type of work that we really need to do quite a bit more of to try to understand. That work specifically looked at subsidized CSA systems and tried to understand how can we make these work better for consumers that wouldn't typically have access to nutritious local foods coming from diversified food systems, and how can we also ensure that it's going to be economically and socially sustainable for the farmers that are running these types of operations. So, something that I think is great about that work is we specifically were looking at subsidizing CSA options. So it's more of an incentive than it's more of the carrot than a stick. And I think when we look at policy options, we can see that price levers work, but depending on how they're used, they can be regressive, and we want to be really careful that that's not the pathway we take.
Thanks, Emily. Unfortunately, we are out of time, and I feel like we could continue this conversation well into the future, and I look forward to doing that offline and hopefully someday in person again soon. On behalf of the Gund Institute, I want to again thank Emily and also everyone who joined today online. We'll have the video and the podcast of today's talk available by next week. Please join again next Friday for the next Gund Exchange with Dr. Teresa Mares from the University of Vermont, whose talk, A Renewed Call for Social Sustainability, Putting Worker Justice at the Center of Sustainable Food Systems, will be on February 26th. And I also want to share that new this week, there is a Gund Community Social Hour immediately following this webinar. So in order to join, you would have to close out of this webinar, check your emails from Nora, your calendar invites, and join via Zoom that session. So hopefully we'll see some of you there.
Thank you so much, Carolyn, and thank you to the Gund for this opportunity to talk. It was really a treat to be able to share my work and hopefully have an opportunity to meet some new collaborators.